Hi, everyone. Uh, my colleague and I are excited to share our project findings. And this is our WomenLift project, which is focused on leading a culture of research for women in Africa. And we're exploring an emerging framework for understanding barriers to research participation. My name is Beryne Odeny, and I'm here with my colleague.
Nwaozuru.
So a little bit about ourselves. As you heard, my name is Beryne Odeny. I'm a medical doctor and an assistant professor of surgery at Washington University in St. Louis. My research focuses on implementation science with an emphasis on global health and cancer prevention, and particularly strengthening health systems to incorporate cancer screening into routine practice.
And I am an assistant professor in the Department of Implementation Science at Wake Forest School of Medicine. My research focuses on promoting HIV prevention and cancer prevention using participatory approaches. And part of my work is also in the global health space and also capacity building.
So we're going to look a little bit about why this project. So in terms of the context, I think that's important for us to know why this is so important. Um, there's notably low research productivity in Africa and low-income countries, despite the disproportionately high global burden of disease in these countries. Existing evidence and our emerging Timer 2C framework, which is currently under publication, have highlighted barriers to research among healthcare providers who are local to the settings in which they are doing research. The Timer 2C framework highlighted potential gender biases in research productivity. This original framework was developed through a series of interviews and conversations with researchers from different parts of Africa and Middle East, and we came up with like thematic areas that need to be addressed in order for research productivity to be improved and for the culture of research to improve. Women, we see, experience an additional layer of gender-related multi-level barriers to research productivity.
So a little bit about Timer 2C framework. It is a multi-level equity embedded framework that captures six thematic domains and one overarching domain, particularly the research culture that influences research productivity and the research culture. So as the name goes, the T stands for time. So the time involved with research, I for instability, interest, and infrastructure. M for means of funding, E for expertise and experience, and R for recognition both at the local and global level for the researcher, and C for collaboration, both internal and external collaboration, and C for culture, both the culture within the country as well as within the institution.
So our project had two main objectives. The first objective was to validate this emerging Timer 2C framework among diverse women researchers in African countries, so get a larger pool of African women researchers. And then number two was to include a gender lens to this Timer 2C framework to be more inclusive and more gender responsive in its approach to addressing and understanding barriers to research.
Our research objective aligns with the leadership styles in four main domains, particularly when we think about authentic leadership, as we're trying to co-create how we refine the Timer 2C framework. Inclusive leadership is also central to this project as we amplify diverse voices. Strategic leadership as well as impactful leadership also comes through as we hope that we're able to move forward with this project and create a tool that inspires change in the research culture using a gender lens.
So how did you implement this project? We'll share a little bit about the methods. So first, we recruited a number of women, leveraging our networks, referrals, and the snowballing approach. We reached out to a diverse group of women across East, West, and South Africa, and we reached out to both established and emerging women researchers. We conducted semi-structured interviews using a guide that was based on the comprehensive Timer 2C domains. And we have an excerpt of that on the right for you to see a sample of our questions. We had planned sample size of 20 participants, and we planned to analyze transcripts, to have the transcripts transcribed in verbatim, and did both deductive and inductive analysis for the themes. So in terms of our outputs, we were able, as we said, to share those refined and finalized interview guides. We conducted interviews with 7 women so far, so 13 more to go. And we were able to interview 3 women from Nigeria, 1 from Kenya, 1 from Uganda, and 1 from Tanzania. We also given feedback from one of the advisors on WomenLift, have initiated a study advisory board, which has 5 members so far. Next.
In terms of the output, we were able to get feedback on the timer 2C across the different domains. With time, research is deprioritized due to the lack of protected time, fatigue, and burnout and sleep deprivation women experience. Also, weak national policies and limited resources hinder protected time and research infrastructure based on the feedback we received from the participants. We also learned that some women have additional home responsibilities that impact research productivity. In terms of instability, interest, and infrastructure, very similar to what the Timer 2C initially had, instability pushes for survival-driven clinical and teaching work among researchers, which impacts research productivity. Interest is also a key factor that drives individuals, institutions, and nations. Infrastructure also came out as a cross-cutting issue, regardless of gender. There are issues at the institutional as well as the national level, challenges such as power outage as well as internet instability. Funding was also a cross-cutting challenge at all levels as we think about the means of funding for research. For women, while funding opportunities do not discriminate, the dynamics around access to funding and how to conduct this research plays out differently at gender level. In terms of expertise and experience, at the individual level, factors such as training, confidence, and access to mentorship and sponsorship influence the development of research expertise and experience. And at the institutional and national system, this shape individual outcomes through the availability of research opportunities as well as funding mechanism and clear career pathways that exist for researchers.
We also saw that in terms of recognition, women noted there was limited visibility and recognition and compensation for their research across all levels, be it at the institutional, national, or global levels. There were gendered norms in recognition. Men are more likely to self-promote and be acknowledged, while women who self-promote are biased, that there's a bias that they face when they do, and even some form of discrimination. Structural impacts on careers, such as women's contributions, are normally minimized in collaborations and authorship, which affects their promotion and advancement. When it comes to collaboration, we found that, for everyone, supportive research communities are essential for idea exchange, for funding and access to resources. Both emerging and experienced researchers rely on these strong networks to thrive. Women particularly reported being that they need to be part of a club, and there was this exclusion from informal networks or invisible networks, which limited their access to funding and promotion opportunities and also publication. At the societal level, culture was an issue that women are still contending with. Both societal norms that frame women's academic ambitions as being secondary to marriage or motherhood or caregiving, leading to research success being termed as misplaced priorities, and also the cultural pressures outside of the academic institution that persist regardless of those institutional policies, which create invisible barriers and constraints for women's productivity and advancement.
Some of the notable additions that came up was that in low resource contexts, unmet basic needs such as income, food, housing, and family responsibilities really limit that capacity for internally motivated research. There's also that disconnect between doing research and everyday decision making. And as we think about the larger global inequities when it comes to research, therefore that devalues local research productivity and publication, compounding some of these recognition gaps that women experience. Here are some notable quotes that emerged. So, for instance, a participant had mentioned that male colleagues are more likely to be better connected in their networks and have deeper connections than women.
So in terms of our next steps, first of all, just as by way of conclusion, which is just a conclusion to be continued. Overall, women who participated in the interviews, they found this framework to be comprehensive in capturing the major barriers in terms of the thematic domains that we need to think about. We observed strong convergence and triangulation between the original Timer to See model or framework and our project findings. Participants highlight important gender-specific dimensions within those key domains that should be addressed in future research capacity building efforts.
And for the next steps, we'll conduct additional interviews, convene meeting with our advisory board, and we also hope to further initiate a podcast series to share some of the emerging themes. And the hope is also to develop some sort of objective evaluation framework based on this updated Timer 2C, and to further continue this work by potentially seeking out for funding. So shamelessly plugging this, if there are opportunities, please do share with us.
So I want to thank everyone who has been so instrumental to the successful implementation of this project so far, the WomenLift team, the facilitators, our peers, the interview participants, and our advisory board. Dr. Dorothy Mangale was very crucial to the development of the guides and the framework, and also Dr. Nadia Samagudu. Thank you all.
Thank you.